In Pir Baba Buner, the skies didn't just rain water, they poured down devastation. Recent flash floods erased livelihoods, damaged homes, and severed access to the most basic human need. But into this isolation, a bridge was built, a bridge of hope. Heads in Penny Appeal arrived, not just with medicines, but with a promise. The promise that no community is alone in its suffering.
Today, we have set up a free medical camp here in Bhatai village. We chose to establish it inside the village because although many camps have been set up on the main road and in the bazaar, women, children and the elderly have very limited access to those locations. By setting up the camp here, it has become much easier for the elderly, women and children to reach. So far, more than 400 patients have come.
An epidemic situation has developed here, affecting women, men, the elderly, and children with various diseases. The local medical stores and the main market of Pir Baba were also damaged by the floods, which caused a severe shortage of medicines. In these circumstances, our brothers from Heads Organization and Penny Appeal Organization have set up a medical camp right in the center of the village to serve a population of around 8,000 to 9,000 people. The camp has been set up in the middle of the village because, although camps are also established outside, women, the elderly and children cannot easily reach those locations. As you can see behind me, there are women, children and elderly people present here.
This medical camp became more than a clinic. It became a sanctuary. Here, highly skilled doctors treated everything from skin infections and respiratory illnesses to the anxiety that follows trauma. Each consultation, a step toward recovery. Each medicine packet, a lifeline.
Most of the patients who came were suffering from eye infections and skin infections, with rashes appearing on their arms and legs. There were also people with throat infections and stomach diseases. In fact, the majority of patients were those with stomach issues and eye infections. Yes, there were also women who had been affected in terms of their mental health. They said that even now, whenever clouds gather in the sky, they feel a sense of fear that perhaps another disaster might strike. So the mental health of many people has been badly affected. In Buner, there is a DHQ hospital, RHC, and BHO. But the burden on them is extremely high. Therefore, we need more medical camps so that people can benefit as much as possible.
This medical camp was organized after the devastating floods, and we already knew that after such disasters, certain diseases are bound to spread. These are what we call communicable diseases, illnesses like malaria, typhoid, rashes appearing on the body, throat infections, and many others that we had expected. Today in this camp, we have examined around 300 to 400 patients. Some of them were suffering from typhoid, others from malaria, while many came with rashes on their skin. The medicines provided by the organizations here have been of excellent quality and also in good quantity, which has been a great relief. Bhatai village is one of the primary affected areas. Here, patients were handled very carefully and medicines were distributed in an organized manner. But the challenge is growing day by day because the population is large and diseases continue to spread. For example, today you may find 3 members of one household who are sick. Tomorrow that number could rise to 10 or even 20, and very soon the entire neighborhood might have 50 patients. This is exactly what we mean by communicable diseases. They spread quickly, and after any disaster, the risk of their spread is extremely high. The people here are also in need of mental rehabilitation. We need a proper psychology team to come and provide mental health support, because the trauma is real. They also require financial assistance as their businesses have been destroyed. Their houses are still filled with mud, they lack proper clothing, and they are in urgent need of food supplies.
In the shadow of destruction, humanity rises. Each act of care, each shared smile, is proof that resilience lives here. These families are not defined by disaster, but by their courage to rebuild, together. Heads and Penny Appeal came to Buner with medicines, but left with something greater. Stories of strength, hope, and unity. Together, we are not just healing wounds, we are building bridges of hope.